Welcome to the Pandemic Files podcast, hosted by Dr. David Adnero. With each episode, we will be exploring the unprecedented public health response and those involved in it. More information can be found at thepandemicfiles.com. You can also subscribe on your favorite platforms, including Spotify, YouTube, and SoundCloud. I would like to welcome four very special guests to the Pandemic Files podcast: Dr. Stacey Barnes, Andrew Cohen, Stephen Hochman, and Kat Vlasica. They were my colleagues in emergency medicine while I was at St. Joseph's University Medical Center in Paterson, New Jersey. They are seasoned emergency physicians who have worked in one of the busiest and most demanding emergency departments in the country. They are also educators who have mentored and befriended a generation of residents and medical students. Our conversation was a frank discussion of the stresses, strains, and scars that occurred to physicians during the pandemic. It is also an inspiring story of dedication, teamwork, and collaboration. I want to thank you all for joining. When I came up with the idea for this podcast, which is mainly focused on the response to the pandemic from a public health point of view and an emergency response point of view, and the first series of episodes that are being released now are really about the field hospital and what people did there, I realized that if we were going to tell this story, I think we needed to also include why we were doing what we were doing, and that really translates to what were the people on the front lines experiencing. And so this episode with you all as emergency physicians, I think, is really important. I was not there in the emergency department during the pandemic, so I thought it was really important to get that perspective of what that was like and how you all dealt with it and where it has had impacts on you and where you think our profession of emergency medicine is. So I think to start out with, take a minute, introduce yourself, the people who are going to be listening, and just talk about what you were doing both professionally and personally, let's say in February of 2020 before the pandemic was coming on.
Sure. Hi, everybody. I'm Stacey Barnes. I'm an emergency medicine physician. During February of 2020, life was pretty normal. I was living at home with my husband and twin girls that were 2, almost 3. Life was busy. You know, we were out and about. We would go to play groups. We would have activities at the library. I dropped them at nursery school in between maintaining my full-time work schedule as an associate program director. But life was normal at that time. And then the pandemic hit and it's completely changed.
For those who are not familiar, could you talk about what you were the associate program director of?
An emergency medicine residency. I am responsible for training and teaching emergency medicine residents after they graduate medical school and before they're out on their own to practice independently.
Hey, Steve, do you want to just talk about where you were professionally and personally in the pre-pandemic?
Sure. So my name is Stephen Hochman. I'm also an emergency physician at a large teaching hospital in northern New Jersey, and I am the research director for our department and our residency program and full-time faculty. And like Stacey says, you know, life was moving along. We were working our shift, teaching our residents, doing what we normally do in early 2020. And I remember the week that the world changed. I believe that was the second week in March for us in the New York metropolitan area. A number of us were at the CORD conference in New York, the National Emergency Medicine Teaching Conference. And I remember for the first time bumping elbows with people as opposed to shake hands. Maybe 5 people out of 1,000 were wearing masks. I remember there were some faculty from other hospitals that were instructed by their institutions that not to come to this conference. And I thought that was pretty excessive. And then I remember celebrating my mom's birthday on Wednesday at a crowded restaurant in New York, basically going about our business. And then Friday, the entire world changed for us. And New York shut down, and we started wearing masks, and we started dealing with patients in the hospital, and the pandemic started. That was the beginning of the pandemic for me.
Andy, what was going on in your world?
Well, my name is Andrew Cohen. I'm also an emergency medicine physician. I work alongside pretty much everyone that's here as a guest, and pretty much, I would have to say, similar, working my full-time shift in the emergency department. And I'm going to be honest with you, during February before we shut down, it was a little ominous. My father-in-law, who will work his way into the story, was a pulmonologist, and he was pretty much following what was going on in China and then Italy. And remember sitting down with him and my wife. Basically, I to this day just remember him saying over and over again, "This is not good," and he was very right. So up until it was probably maybe 2-3 weeks before we shut down here on this side of the country, that was pretty much, it wasn't an immediate thing. It was kind of a slow progression, just seeing things get worse and worse and worse in other areas of the world.
And Kat, what was life like for you at the beginning of this?
So, hi, I'm Kat Vlasica. I am an emergency medicine physician, and I've been so for well over a decade. I, at the time, was a full-time emergency medicine physician and a director of emergency medicine pain management at our hospital. And we were running some projects regarding opioid use disorder patients and pain management, and starting up new curriculums. Simultaneously, we were living in New York City with my husband and at the time 9-year-old daughter in 3rd grade. And, New York City had a whole separate feel to it as I've never seen in New York. People were kind of rumbling about it. And I remember watching the news and having the sense of denial, like, oh my goodness, what's happening in Italy is that could not possibly happen in New York City. And you hear it getting closer and closer and closer. And that anticipation was just very nerve-wracking as for an emergency medicine physician waiting for that wave to hit you. So life was normal, and then we kept on having these episodes of more and more denial, and then it hit.
How big of a space were you and your husband and daughter living in, Point?
So we were living in a very luxurious Manhattan-sized 800 square feet.
Okay.
Nice.
I think that's going to be a relevant thing. One of the things, obviously, that I think it gets mentioned a lot in emergency medicine even before the pandemic, and this is true of physicians and nurses, was burnout. So what was your burnout levels like in terms of clinical medicine going into the pandemic? Well, I want to spend most of the time of having you all talk. I will say that mine was pretty high.
So before the pandemic started, hindsight's 2020 in terms of burnout. I had my frustrations with the job. I was hitting that 11, 12 years out of residency mark where some people start to feel the burn. You're tired of some night shifts. You're tired of some swing shifts. Sometimes work is getting in the way of things that you want to do with your family or other life things. So I was starting to feel somewhat burned out, but I was lucky that I had another part of my job that helped stave off that burnout, being in academic medicine and getting protected time to teach and work with residents. I think I was feeling the normal level of burnout before the pandemic.
My take on that, I don't really feel like, quite honestly, I've ever felt particularly burned out on this job. I have my highs and lows like everyone else. I've been doing this for 19 years or so. And I guess, I agree with Stacey, having something else to do in the emergency department, teaching residents, running research projects, doing quality work, has always kind of just been a good balance against just being a pit doc three or four times a week in clinical shift. And so that's kind of given me balance. I've sort of figured out over the years how to kind of deal with levels of burnout when it comes. So I don't really remember feeling particularly different in early 2020.
Andy or Kat, anything you want to add on this subject?
Sure. At the time, right before the pandemic, I was full-time and I wasn't smart enough to go ahead and have other things to balance. So if you ask me between scale of 0 to 10, 0 being no burnouts, 10 being full burnout, I was probably at a 3 to 4. And I think what really contributed to that is really the overnight shifts and the ones that ended at 2 a.m. That was the thing that really got to me. It was really more of not being able to recover as quickly as I was able to back in residency. But otherwise, I still really enjoy taking care of patients, taking care of challenging patients that really made you think. That pretty much was still there. So that really is what my driving force to stay was. I just needed to figure out a way of really just doing a balance. And I never really figured that out before the pandemic.
Yeah, so one of the nice things about working where we work is whenever you enter academia significantly prolongs your half-life in emergency medicine. So the idea that you are not just quote unquote a pit doc is very, very rewarding because you actually get to explore every single aspect of your job. And even going back to the Latin words of the word doctor, it's docere, it means to teach. So when you are actually teaching residents or medical students or the staff, you're fulfilling the main role of being a physician. You are not just taking care of patients, you also have to teach the public. And I had just stepped into a role that was something different. It wasn't just shift work, and I was actually kind of excited about it. And then everything that we were doing completely shut down. I remember a project that we were doing with the State Hospital Association with just giving lectures on opiate sparing measures and everything. And that just completely got shut down during the pandemic and it never really came back on. So I had actually just gained momentum away from burnout. I think I was working a full shift load. It would have probably been somewhere in a scale of 8 to 9. And I moved into a different direction, and I had a new way of filling my bucket at work.
As we're about to talk about the pandemic, I think it would be useful to provide everybody an understanding of the environment that you worked in. At that time, all of us were in a hospital in northern New Jersey. It was the largest emergency department in terms of the number of visits in the state of New Jersey, and I think the third or fourth in the country. So it was about 140 to 150,000 visits a year. It was the length of a football field in length and about the width of half that, and had over, I think, 130 dedicated spaces for care. And at peak would have, and I'm going to lose count so they can correct me, probably around 10 physicians, emergency physicians on duty, along with a few nurse practitioners and probably about a half dozen residents in emergency medicine or pediatrics, and staff of 30 or 40 nurses, techs, etc. When did you know this was a pandemic? Like, life had changed inalterably and things just were not the normal craziness of an emergency department.
I think when the ER went quiet.
So there was a period of time where everything went quiet before then chaos broke out?
The chaos was the quiet. When we were at the main wave, I guess, of the pandemic, we stopped allowing visitors coming into the emergency department for obvious reasons. The patients were typically kind of sick and they were not really able to talk. And all you could really hear are the noises of the machines. And things just got really, really quiet. As in, the ER is never quiet. It's never quiet figuratively or logistically or in any sense of the word, but the ER went quiet. There were no visitors. There were very few staff members coming up to you because everybody was pretty much sick and holding on.
Yeah, I don't really remember sort of a point in time when things absolutely changed. I remember there being sort of a couple of week transition because COVID was in the news. People started wondering, well, gee, do I have COVID? And so lots of people would come to the emergency department with sniffles or a little cough or a low-grade fever or very minor symptoms, but basically they were not sick. And I remember we started telling people, stay home. If you're not really sick, stay home because you're just overwhelming the system and there's really not much we're going to be able to do for you. And to a large extent, I think we frightened a lot of people from coming in, which was in some ways a good thing because I guess over time we started seeing more and more sick patients. And I remember the first patient I admitted with COVID, I was like, wow, she has COVID. She's really sick and she's not going home today. And it was a big change because there were so many people that we were seeing that weren't sick. And the other thing about it was that at the time we didn't really have access to tests. We had very few tests. So tests were only used for patients that were going to get admitted. Therefore, we basically decided everyone that had an inkling of symptoms that suggested COVID, we can say, assume you have COVID, you're safe enough to go home, we have no treatments for you, isolate yourself, supportive care, fluids, Tylenol, rest, stay home from work, try not to infect others, and you'll probably get better. And if you get worse, come on back. And so that's pretty much the way. And then over time, it was all we were seeing because everyone else, if they weren't really sick, like with appendicitis or with, having a heart attack, they weren't coming to the emergency department for minor stuff because we were telling them not to. B, they didn't want to get infected by other people.
Yeah, I agree with Steve. I think I felt COVID in a more gradual onset before it hit us full force. Because at first, everybody has to wear a mask, and then we're learning more, and everybody has to wear goggles, and then we don't know how this is going to be transmitted, and everybody's wearing surgical scrub caps. And then we're stopping, like you said, the visitors. And progression of the learning curve also with COVID patients was huge because, like Steve just said, we didn't know anything about this disease. This was novel to us. And from our training during residency, anybody came in with a low oxygen level at 50%, that was an automatic trigger to intubate them and put them on the ventilator, which was what we were doing, like knee-jerk reflex right away. But then a couple weeks into it, we learned that this was not the best for them. And now how are we treating them with other methods and high flow oxygen? And then just realizing the progression of the disease, that sometimes they came in with this low oxygen, they'd get admitted to the floor and then they'd deteriorate, or sometimes they'd be in the emergency department and 6 hours later they'd deteriorate and need to be on a ventilator. It was a progression and a learning curve when COVID absolutely started in the emergency department. To speak to what Kat said, it was eerily quiet in the main emergency department because the people that got back there were on ventilators or super sick. And I knew that this was different from anything that we had seen when our entire waiting room was made into a testing area and a treatment area for those people that were less sick. And when people were coming in just with mild symptoms, and we had to set up a tent outside of our emergency department just for swabs and screening. I'd never seen anything like that.
So I guess my trigger, and if I remember correctly, the day that things shut down was a Friday. If I remember correctly, it's still a blur. And
March 13th.
March 13th, that sounds about right. And when it shut down, the thought came in my head that, wow, I'm going to have to deal with this. And my wife is going to have to deal with this because she's an anesthesiologist. And I think what really hit home without my kids saying anything, when the announcement was made that everything is being shut down, schools are going to try to move to remote learning, the look of fear in their faces, really more so my son because my daughter was young. I think he had an understanding that both mom and dad are going to have to deal with this. And that's when it hit me. And I'll never forget the way they looked. And not only was I afraid for myself, I was afraid for what my kids will be now dealing with. And they may not necessarily understand everything that's about to happen.
You all, I know, are highly experienced physicians who have, if not seen everything in the world collectively, have seen most of it. I got tired of using the word novel to describe COVID, but it's an accurate description. This was not something that I think any of us had ever dealt with in terms of the depth and breadth of symptoms patients had, the systems of disease, or exactly how to treat it. How was information being passed on? How was the collective decision-making, which went from sort of a national collective of emergency physicians and other physicians, how were you balancing that? How were you trying to stay on top of it?
It was a lot to stay on top of, and it was hard because from the way we always learned is you have to do evidence-based medicine. Things have to go through trials. You have to read about it in different things that have been shown to be true. But we didn't have this with this new wave and this novel virus. So it was just trying to sort through information the best we could. We were looking at what they had done in other countries that maybe was working because there were certain countries that were ahead of us, whether it was Italy, what had they done over there and how were they managing this massive onslaught of patients and what treatments were they trying that may have shown some benefit. A lot of times it was just networking, and a lot of us too were trying to read and scour the internet just from other colleagues and what they were seeing and what practices they were doing. And that's not normally how we learn and how we practice, but it's the best that we had out there. And I remember part of my role as an associate program director is to be in charge of the didactics for the residents. We moved our conference online to a virtual platform, and every week we would dedicate time to updates in COVID. What had we learned? What had we seen? What were we even doing in our own emergency department? I remember we tried to shield ourselves one time. We brought in these boxes to almost put over patients to shield secretions before we were intubating them. That was something that was being trialed at a couple hospitals because nobody knew the best way to treat the patients and also protect ourselves. It was a massive learning curve.
Yeah, and I think the not so funny thing about the whole thing was that we knew almost nothing about this virus when we started. And if you remember some of the things we went through very early on in the pandemic, it was don't wear a mask, that's dangerous. And then that got jettisoned. And then it was don't give the patient ibuprofen. That could be dangerous. That could be inflammation. And then it was like, no, everybody gets ibuprofen, you know. And if you remember, every patient got admitted got hydroxychloroquine and remdesivir.
Oh, God.
Right? Hydroxychloroquine was shown not to have any benefit. Remdesivir, maybe some, but nobody, didn't really pan out. And the reason we were giving that, along with azithromycin, actually, which probably does nothing against the virus, was that we had nothing else. And it was, throw the spaghetti against the wall and see what sticks. Didn't seem to cause any harm, and we had nothing else to treat the patients with. I think probably during that early period, the only thing that really worked was dexamethasone, and that was for patients that were hypoxic, and it seemed to have evidence. But like Stacey says, we were just picking up like whatever there is a network of docs out there that do a lot of social media, and were kind of at the cutting edge of sort of whatever research was being done. So we were keeping up with that. I remember learning a lot on TV news, listening to the pulmonologists and crit care docs that were talking to the public. I would pick up ideas pretty much every night. But it was a massive learning curve that we just felt our way through it, and we made lots of mistakes, and it was a lot of trial and error, and we did the best we could.
Yeah, that was a little bit crazy. I mean, the one thing that you need to keep in mind is that nobody had ever seen anything like this. Nobody. To have somebody saturating 40% in front of you and not even seem short of breath was surreal. The systems failures that we were seeing were unlike anything we had seen. None of the viruses ever behaved like this, too. So you go with what you know until you know better. And it was a crazy learning curve. I remember following Twitter for, of all the places, for a large part of what else is out there, what else can we try? If we run out of equipment tonight, what else can I try? And I remember a string of night shifts where I had just read an article about turning the patient and proning the patient too. And I knew that we were near capacity with our ventilator availability. So we decided, let's start turning the patients until we can get our hands on more equipment. And that worked. And it worked really well. And we were able to avoid intubation on a couple of patients that night. So it was wild how our knowledge base and our skill sets evolved on something that we had never seen before. And we just did everything we could to keep up.
So I guess at the very beginning, when it all started, I pretty much went into every shift saying, okay, whatever I used yesterday, I'm probably going to change today because, again, maybe it's going to work, maybe it's not going to work. And then, as I'll probably get into later, I was out for 3 weeks afterwards. So that learning curve pretty much came to a halt for me. So I assume a lot of my colleagues who were there working pretty much did the trial and error for the entire time, which, again, through all your training in medical school, it's unheard of. Like, you went into work and you didn't know what you were going to do? Yeah, actually, that's kind of what it came to when we had this pandemic. But that's pretty much how I started. Just whatever I used yesterday, I'm probably not going to use today.
I distinctly remember at the beginning of April when my role at the field hospital, we were just about to start talking to, I think, Stacey, I talked to you, Kat, I was talking to you, and a number of other people. And whatever information you were able to provide, I was then passing along to the providers and the nurses at the field hospital, because while you all were getting to do multiple iterations, we literally were going to be seeing our first patients, again, less sick, but still having a lot of respiratory issues. And I just remember how grateful I was to have anybody who had more knowledge than I did at that point. And then to have to turn around and, quite frankly, on my side, have to talk to a bunch of physicians who are not emergency physicians, who are not intensivists, who are not pulmonologists. Some of them were vascular surgeons who were volunteering, and try to translate that into something that made sense in the middle of an empty convention center with no wall gas. So I was very grateful to have you all on dial. And the first time I walked away from a patient whose SAT was 74%, and that wasn't even that bad. I think he got down to the 60s. It was like 300 pounds, and he's on an army cot. And I was like, well, let's try proning him and then see how he does. And I walked away because I needed to let the team kind of figure it out for themselves. And I went, okay, let's hope this is going to work out. And it did. And it was a very interesting experience. But I am forever grateful to the amount of information that you all were providing. Switching gears a little bit during this time period, Kat, you remarked on the quietness. And Stacey, you were talking about the fact that, the patients had to be pretty sick to get to the back. There were no visitors. What was that like to take care of people, many of whom were going to die? And they weren't leaving, and there was nobody else there with them. And unfortunately, it was not an occasional thing, which we all see, but on volume. I can't imagine what that was like, but I'd like to hear how you all experienced that.
It was extremely, extremely difficult to come into shift because most of the time you were bed blocked and bed holding because the ICU upstairs, the surgical ICU, they were filled. So the main emergency department where patients were on ventilators was like a holding unit, and you knew only the sickest people that were getting intubated were getting back there. That being said, we almost had to act like intensivists. We did rounds on all of the patients that were boarding. We fielded phone calls from their loved ones who couldn't come in to see them. I'd spend multiple hours at a desk just talking to loved ones, telling them about how their brother, sister, mother, father was doing and anything that I could do. And there were a lot of difficult shifts because as emergency physicians, we are used to seeing patients die, but in normal times, maybe it's a couple a month, if even that. This was multiple in a shift, which was a hard thing to bear. These people were dying alone and without a loved one at their bedside, and then we'd have to tell their family via phone. So that was an extremely difficult part of the pandemic.
Yeah, I remember I was trained in residency never or almost never to break the bad news over the phone. You ask the family to come in, you tell them that their family member is sick, and we suggest that you come in and we'll talk more. And then when this happened and the families were not coming in, they were not allowed to come in the emergency department, we were having those conversations over the phone routinely on a regular basis. And not having that person in front of you, not being able to sort of deal with their emotions and how they were taking it and are they going to just fall apart right now was just extremely difficult. And it makes a very difficult conversation that much more difficult. And it was really tough. But also, like Stacey says, the routine calls every single day, several times a day. How's my mom doing? How's my grandmother doing? What's happening with her? Can I talk to her? And fielding those calls just occupied a lot of our time.
Yeah, that was rough. As in, there's also a component of a language barrier that occurs whenever you're trying to communicate with patients and patients' loved ones over the phone. It's very, very difficult to have a three-way interpreter iPad facing the patient and then having their interpreter iPad right next to it or your phone right next to the iPad. And then the patient, if they're conscious, they can't hear it. So, or if they're unconscious, it's really hard to communicate that way. So we kind of took turns and pulled our language skills together and decided, okay, you're going to take this dialect and you're going to take these patients and you're going to take this group of patients too. And I remember myself and another one of the nurse practitioners who spoke Polish. I speak Serbo-Croatian, so we kind of took the whole Eastern Bloc and covered those sections, and we did the best we could. We would sometimes we would simply put the iPad next to the patient, and the families would just sing to the patient, and that was as therapeutic to them as I must admit to us. You felt like you were at least capable of doing something, but those iPads were worth their weight in gold.
We're used to being a little bit worried about our own health, right? We take risks. We're around people who have been violent. We're around medications that can do severe harm if not used properly. We're around infectious disease. But the pandemic was different in a lot of ways because there was a concern. And again, this is pre-vaccination. It was the original type of COVID, which was much quite frankly, deadlier than some of the variants that would come along. And everybody has family and friends and, other people they socialize with. What did you have to do? How did you cope with that? And I know personally that each of you, I think, has had different things that you had to do and different experiences. And you couldn't just leave your shift and put it behind, which is a lot what we attempt to do.
Absolutely. It was definitely a big concern because we didn't know 100% how this virus was spread. I remember in the early days, there were people who would wipe down their grocery bags. We didn't know if it was airborne, if it was contact. Like, how is this very virulent virus being spread so rapidly? And going into shift, obviously, that was a concern. On shift, we were wearing, the masks, the scrub caps, the goggles, and clothes. And a lot of us at the end of the shift would wipe absolutely everything down. We change in the little office off of the emergency department into different clothes. And then I remember even before I'd go into my house, I would change again, and I wouldn't let anybody touch me until I showered and fully deconned myself. I had a separate laundry basket for anything that I ever wore to work that could be washed separately, and then I would decontaminate my laundry machine after that. I also made the conscious decision not to see the rest of my family during the pandemic. It was months before I saw them. Me, my husband, my 2 children isolated ourselves at home. We didn't see my parents, my sister, any of my friends. We kind of kept to ourselves. And I slept in a separate bedroom in the back. Just, God forbid I spread this in my sleep to my family. So it was a very isolating, scary time when this happened.
Yeah, I have a little bit different experience. I don't have young kids in the house. I actually live in a house by myself. But I'm an asthmatic, been asthmatic most of my whole life. And I remember at the start of the pandemic, my daughter and my mom said, you have asthma. You shouldn't even be going into the emergency department. You can't do this. And I was like, no, this is my job. This is what I do. I have to do this. I've always taken precautions. I've worn an N95 every minute in the hospital from the beginning of the pandemic to this day now. Never changed. I never stopped wearing a mask. I had a similar decon routine that Stacey just described, where I changed once in the hospital and then changed once I came home and threw all my clothes in the washing machine as soon as I got in the front door, and just did the best I could. And, we're all freaked out. I think life changed a little bit for the better in December of 2020 when we got our first vaccine. That was like the dawning of a new age for us. When we got our first vaccines, I remember we wore those little stickers. We were the first ones on the block to get it, which was pretty cool. And then I think about 6 weeks later, we got our second shot, but still we couldn't drop our guard. Still we still maintained our precautions. I think we just felt a lot easier, even though this was a, kind of an unproven vaccine at the time, that we were a little bit safer after that.
Yeah, you guys are bringing back so many memories that I had kind of forgotten about. Wow. You're basically going into this very on mist into the emergency department. It was impossible for the healthcare system, in any healthcare system, in any capacity, to have a negative pressure room for every single COVID-19 patient. That was impossible. We barely even had stretchers, and that was in every single hospital across the nation. And you have to know when you're going into what is essentially a war zone, the basic rules are, how are you going to protect yourself? How are you going to protect your loved ones, right? And everybody came up with a protocol that they were comfortable with. So for myself, there were 3 pairs of shoes involved before I even got into the house. There was work shoes, then there was ER to the parking lot shoes, and then there are shoes that lived in the car, and then I had the shoes that I would actually wear into the house. It was very complicated. The masks that were just kind of double masked and not coming off. And at that time, as Stacey said, we did not know how this was transmitted. We had an idea, but we weren't entirely sure. So anything you touch could be a contaminant. Off goes all your jewelry that kind of keep on yourself. For women, it was our hair. What do you do with your hair? Is your hair suddenly going to become a fomite? You didn't really want to burn all your hair off as you're showering with the hottest possible water imaginable. So we actually all got scrub caps that were going onto our heads. And I remember after the pandemic, the first time the scrub caps came off, people kind of looked at you like, oh, you have hair under there? You're a blonde? What? So it was a procedure that you kind of all had to go through. And for ourselves, we lived in a New York City apartment. There's no social distancing in 800 square feet at all. So I had to move out. And we were lucky enough that we were plugged into a hotel system that was allowing healthcare workers to stay there for free for periods of time. And that was a lifesaver because I could at the very least eliminate the idea of, God forbid, I contaminate our 9-year-old and she gets sick, or if my husband were to get sick, what would I do? Yeah, I don't think that if they were to get sick and anything were to happen to them, that just would simply not even be survivable.
How long did you stay in the hotel for?
Because I would stay in there for 2.5 weeks and then repatriate into our house. If I would watch myself for symptoms and go in, it was at the very least a couple of months.
And while the people use the term war zone for experiences, I would imagine that you having actually lived in a war zone earlier in your life, that this may have brought back some memories and fears for you.
Yeah, that was. I grew up on the Bosnian border in South Croatia, and there was a period in my life where we were shelled. Our city was shelled, and for many months, and a couple of times we found ourselves back in the middle of it all. It all depended on how the front lines were moving back and forth, and the parallels are significant. And I don't know what it's like to be a military member, and this is not in any way, shape, or form a comparison to what the military goes through, but as a civilian living in a war zone, the parallels were significant. You have the food insecurity. Everybody remembers the food lines to get into a grocery store at that time. You had your basic safety as you're going into work. You had the safety of your family members. How many layers do you need to keep yourself safe? So when you're getting shelled with a standard 80 millimeter shell that was de jour in the Balkans at that time, you needed 3 layers of concrete on top of you. Our job was to figure out how many layers you needed to go into work. The parallels are there, and I think it's helpful to realize that in terms of what kind of work one needs to do afterwards to really realize what kind of a collective group trauma we've all experienced.
Thank you. So, Andy, you had small children in your house. You also had your in-laws living with you. I've also talked about being out of work for a few weeks. Do you want to share what that experience was?
Sure. I will try my best not to turn this into a therapy session. But so my in-laws, probably in 2010, we were expecting our daughter, and both my wife and I are physicians, and our schedules often didn't match up, and we were looking for possibly a nanny, and my in-laws were looking to move out of their house, and it really only made sense to have them move in with us. And I know what some people are thinking, oh my God, your in-laws are moving in with you. Are you out of your mind? But I actually have always had an absolutely wonderful relationship with them. So they moved in with us for 2010. My mother-in-law, she was a retired nurse, and my father-in-law was still a practicing pulmonologist. And I alluded to the weeks leading up to the point where we shut down, and just having discussions with my father-in-law, who was obviously very interested in this, and him saying that this is not going to be good. And in the end, he was absolutely right. My mother-in-law had a lot of medical problems. She had a lot of chronic issues. And at the very beginning of the pandemic, when everything was starting to gear up, I tried my best to stay away from her, because I thought to myself, if anyone gets sick in this house, she will be the one most likely to get the worst of it. And there came a point in time where my father-in-law, believe it or not, started having some symptoms. And again, he was still practicing, seeing people in his office. And he had made maybe 1 or 2 visits to the ER. And at the time, they had COVID tests where you'd get the result in 5 days, 6 days. And there was one night where, I'll never forget, they lived downstairs from us, but my mother-in-law called upstairs to us saying something's not right with Barry. And we went down, and he was basically on the floor, semi-conscious. And at that point, we called 911, and I will never, ever forget this. I was actually a paramedic before going to medical school. You'd go into the people's houses, and it was just a weird privilege that it was just expected. And literally, we're outside on the driveway in the cold, and they were asking us, do you feel comfortable taking him to the hospital? Because at that point, by the time they arrived, he was awake, he was talking, he actually sounded lucid. And they're literally 20 feet standing from us, asking us, do you feel comfortable taking him to the hospital? Because if it wasn't absolutely necessary, they weren't going to do it. And I understood. I understood where they were coming from. So he went to the hospital. 2 days later, my mother-in-law started having symptoms. And I remember my wife drove my father-in-law to the hospital that night. It was probably 1, 2 in the morning. And the following day, or the next day, I drove my mother-in-law to the hospital. My mother-in-law didn't last very long. She quickly, probably in 2 days, passed away. And in the Jewish religion, you try to bury people relatively quickly. And it was amazing how it would take 5 to 6 days because there were just so many people dying that there was literally a line to get buried in a cemetery. And she was planned to be buried. We were going to do the services at graveside. And again, it was just going to be my family and my parents. That's really the only people that were allowed at gravesite. And we actually had a delay. We had to delay my mother-in-law's funeral because that's the day my father-in-law died. This is something, and something you would see in a movie, that you delay someone's funeral because their spouse died. And after that, I obviously was in contact with people from work, and they told me, don't come back. It really set into motion a lot of bad stuff in my head. To this day, I'm still working through. We talked about burnout. This definitely accelerated it. I would say probably 5, 6, 7 years. From feeling the guilt that I was the one that brought home the virus. You can make arguments that it could have been one of my father-in-law's patients that he saw weeks leading up to it. It's very plausible, but in my mind, there was a chance it was still me. I then had, for some strange reason, the unbelievable desire to go back to work. And multiple people told me not to, just take more time. And I didn't. And I regret. Going into work, I'll never forget my first shift. For whatever reason, I drove there probably an hour early before my shift started and literally sat in my car. I never dealt with anxiety ever in my life. And it started that day. Well, it probably started before that, but it manifested. I literally felt like I was talking myself off a ledge just to get in there. And it's funny how you see things, nothing good comes from Facebook, but there was this one post from an old resident that I used to, colleague resident. It was a picture, it was a artist's depiction of the COVID virus and a healthcare worker standing in front of it, giving it the middle finger. And literally months after I returned, I would literally stare at that stupid picture in my car. It was on the back of my visor. And I would literally stare at that thing at least 20, 30 minutes before going in. And then there's a lot of other things that were going through my mind. Then in the guilt, the fear, and it got to a point where I just sat back and questioned myself. Why would I even do that? I just lost both of my in-laws. My kids were visibly scared that I was going to have a similar fate. Why would I go back? And to this day, I still can't answer that question. That with all this that went on, I went back. And it questions, do I really know if there's something really dangerous to run and not go? And it's been very difficult to deal with. It really has.
First of all, thank you for sharing that. I don't think anybody gets out of our profession without scars. I think I've been very open in social media about the fact that I needed time off after the pandemic and, quite frankly, medication, which I probably should have been on years ago to deal with anxiety. And I had nothing of the sort of what you're describing happen to me or my family. So, I appreciate the openness. I think this is something that physicians don't talk about, which is the impact that what we see and do and what happens in our family has. So I appreciate you sharing it.
You're welcome. And, I guess one other thing I feel needs to be said. What we do is outside of a pandemic. I had a colleague who sees a therapist, they were telling me, once a month, just because our jobs are rough. And I'm going to be honest with you, the anxiety got so bad, I have basically been speaking with a therapist therapist, and this is something that I'm not afraid to be open about. And we both decided that I don't think I'm at the point that I need anything other just to talk. But ever since mid-November of 2020, at first I was speaking to him twice a month, and then now I'm kind of like at every 3 weeks to a month. And people, it's true, they put a label on people who see a therapist, and I have very strong feelings against that, because you know what, we need an outlet. We see things that a lot of people don't. We're put in situations that a lot of people can't even imagine. So I think it's important, even if nothing really bad, just the stresses of the job. I think it's needed.
And this is a difficult segue, but I think this is a good time to ask, the other guests. We talked about what your burnout level was before the pandemic. And obviously, we're mainly focused on those beginning few months of the pandemic. What was your burnout levels like? What was your mental health like, if you want to share, coming out of it? With hopefully your family's intact, but knowing the things that happened to Andy's family.
So I have to say that during the pandemic, in some ways I did have a little relief of burnout from my actual job. I felt fully needed. I felt that I was really doing my job and helping the people that I could help. And people were supportive, not just my general family, but the entire public in general. Whether it was watching the news before I went on to shift and seeing people in New York City banging pots and pans to cheer you on, whether it was just people within my town sending me cookies, restaurants giving healthcare workers food. I felt very supported and almost reinvigorated in my chosen profession and what I do. That being said, once things started to die down a little bit over the summer months, some of the burnout returned. At least initially, it was kind of getting back to a little bit of normalcy, like, okay, things are easing up, COVID's kind of going away, this is the new normal that I'm going back to. But it was interesting how that during COVID, I didn't feel that burnout that I had felt before.
Yeah, I agree with Stacey. It was, in some ways, this is maybe the wrong word, but in some ways it was kind of exhilarating being involved in this project. We kind of felt like, we were saving the world. We were taking care of the sickest patients out there. We were doing it every day. We didn't have the same kind of isolation that most of the world felt with the work from homes, because we were going into work 3 times a week, and we were, working with our colleagues and keeping people alive and responding to every emergency in the department. And I remember Zoom was not a thing before COVID, and now it's become everything, almost in every aspect of our lives. And so I remember in the residency, we had once a week, we had kind of Zoom get-togethers with residents to kind of bond a little bit, have a drink at home, just talk about our days and our week. I had a Zoom Seder with my family. I had a Zoom Thanksgiving with my family. I would hang out with my kids once or twice a week by Zoom, and my son's in Denver, my daughter's in Brooklyn. So it kind of brought us closer together. And I think we all, in our own ways, we sort of adapted and drew some strength from the way we were able to cope with COVID. I just will say, I just want to respond to Andy that I never really heard that story, how you personally dealt with that and experienced that. I knew what happened with your in-laws, but all of us were hit by COVID, but not many as hard as you. And I just thank you for sharing that. And I think it's a testament to your fortitude that you've carried on. You continue to do this.
Thank you. I still believe, obviously it felt like it's knocked me down. I'm still searching for the silver lining. I'm confident it's out there. Not really sure I found it just yet, but thank you.
So just in terms of burnout, and I'm with you guys at first, like that. At first you felt like the heroes, right? There was a 7 p.m. clapping every single day. And that was, hearing that in New York City every single day was always an experience. I remember in our building, there was a New York Philharmonic tuba player living 2 floors above us. So every night at 7 p.m., you weren't just here to clapping in a pots and pans. There was the tuba player above you that would keep on just blaring for a good 10 minutes. And then across the gangway in the another building, there was a woman screaming a zagruta back at him. So they would have a whole concert going back and forth, which was really quite something. So you were carried and propelled forward by the public support. However, what you're left with is still just this horrific scene that I don't think many people really even understand what it was like to just see people dying and people dying alone and people dying from just this great unknown thing. And you just keep on praying that it's not you next week in that same position with an iPad next to you and your family trying to sing to you. I think as healthcare workers in general usually parallel the military and first responders in their dispositions towards these group traumatic events. We compartmentalize. We compartmentalize everything, and we compartmentalize for years, stubbornly, until you need a freaking fasciotomy to get all of this out. And it's impossible. There's also another popular coping mechanism for us is the dissociation. I did something during the pandemic that I never did. I signed up for Netflix. I hate Netflix. It's just a mind suck for me. No offense to anybody who does it, but I remember watching Tiger King in about 2 days, and it was just such great escapism. And we avoid it. We avoid talking about the things that we see. And what was really a positive thing, and the one thing that kind of carried us through, is that every day that we came to work, we have such a large ER that there was somebody there you can talk to over a slice of cold pizza. You know, you can vent about the things that were happening. You could just talk about the patients and in just a co-sympathetic way. And you can talk about your families and how long it's been you've seen them. So we had somebody to talk to. People at home working from home, however much they could, did not. So that was at least one thing that was a positive and still coming to work, especially in the summer months when the 7 p.m. pots and pans started dying off and you didn't know, are we still doing the pots and pans? Are we not doing the pots and pans? You were still able to come to work and talk to the people that were going through the same experience. I do remember at one point I realized I was still having nightmares and horrific flashbacks, and I couldn't sleep through the night. And just because I was having flashbacks to 30 years ago when I was a kid, and I ended up calling a physician help hotline during that time that was set up by volunteer psychiatrists, because I just had to chew out the trauma that happened from 30 years ago that was never actually resolved, because compartmentalize, avoid, deny was a common coping mechanism. So that was actually incredibly helpful. Talking to coworkers and realizing that you move forward and you have to see the silver lining, but it's really hard in that situation.
We have a few more minutes, and there's a couple things I want to get to. What I'm now curious about is, what impact do you think the pandemic's had on our profession, on physicians and nurses who work in medicine or emergency medicine? What's kind of the state of health of emergency medicine and those who work in it?
I can definitely say that after the first wave of the pandemic, the emergency department changed a lot. A lot of nurses decided to get out of emergency medicine. They decided to go to other specialties in medicine that were deemed to be less stressful, whether it's being a PACU nurse, working in an endoscopy suite, because the pandemic had been an overwhelming and understandably stressful experience. An emergency medicine trained physician, like many of my colleagues, emergency medicine is what we do and what we trained in. Several colleagues have left and have gone to urgent care settings and gotten out of the emergency department. And there are some of us that are still, hanging on for the ride. In terms of applicants in the future of emergency medicine, initially after the pandemic, our number of applicants dropped tremendous. Board scores of the applicants were also much lower. Our application pool was almost cut in half. Pre-pandemic, at our hospital, we had maybe 1,200 to 1,300 applicants for 8 spots. One of our lowest years, we had a little under 600 after the pandemic. A big drop. Numbers are starting to pick up slightly, but they're nowhere near the pre-pandemic pool of applicants to the field that we have seen in the past.
Stacey, thank you. Steve, what do you feel has been the effect in terms of just the care of patients, the nurses who are there, the experience you have working as a physician in an emergency department?
I don't know that it's a whole lot different. I mean, certainly post-pandemic world is definitely not the same as the pre-pandemic world. I think in a lot of ways, the emergency department has returned to what it was pre-pandemic, when we had highs and in COVID, and then we would see some lulls in COVID. The department got pretty empty. People weren't used to coming to the emergency department for every problem they had. And so when we weren't seeing COVID, we weren't seeing much of anything. You can go in a night shift and see 6 to 8 patients in a night. And that's changed. People are now back and forth, and the wait times are up, and the beds are filled, and the holds have increased in the emergency department. People coming back for everything, including COVID, flu, RSV. And I don't know. I think we have just a different sensibility that COVID is out there. COVID's always a possibility. We've now gone back to screening every patient for COVID that we admit, whether they get admitted for COVID-type symptoms or not. And, I think we're back to masking and restricting visitors in the emergency department. So certainly have not seen the end to viral outbreaks. And there's going to be another big thing down the road.
Andy, after the pandemic, I know you've made a change in where you work and what you do.
So in terms of burnout after the pandemic, as I mentioned, it was pretty high. And I was at that point looking for a place where I can do a combination of ER medicine. I still wanted to do it. I just knew full-time ER medicine was no longer in my future. I was done. But I knew I still wanted to take care of patients. I know some people move to the non-clinical world, and that is not something I was looking forward to do. Maybe later in my career, yes, but I wasn't ready to do that. Just the rigors of a full-time ER doc was done. So I switched to a different hospital who had plans to actually start up an urgent care. And I pretty much said that even though the urgent care was not set up, it was in the planning phase, I would still work full-time as an ER doctor with the anticipation that once the urgent care was set up, I would split my time between the ER and the urgent care. Unfortunately, that urgent care never got mobilized. And the hospital that I moved to, I'm still there now. I work 1 day a week. And through another hospital, I'm working at their urgent cares pretty much 2 times a week. So it's a nice compromise. I get to the point where I am sick and tired of seeing URIs, COVID, flu, doing all those tests. I say, okay, I'm ready for my one shift a week at the ER, and then I'll do that for a day, and I'll say, wow, everyone is so involved. It was challenging. It was, it picked my brain, but I need to go back to the flus and colds again. And it's like back and forth every single week. It's working out really well, actually.
Nice. And Kat, you had talked about academia, and certainly your academic role, I think, has increased. Any thoughts on the post-pandemic world and what it's like?
I think the pandemic has, for those of us who were in the midst of it, worked full-time clinical during that time, it's irrevocably changed our work in emergency medicine. Maybe not the job, maybe not the treatments, but it's changed us. And I think if I were a full-time pit doc, there is no way I could keep going. So I was lucky that I'm in a place that actually promotes academia and they want to develop their doctors, and it sometimes takes you into a different direction. And I have, after almost 20 years of being an ER doctor, found a new love for a part of emergency medicine that I like. So I've kind of thrown myself into a different role, and it's now definitely a lot more academic, but it's provided a much needed outlet for the post-pandemic world, at least for my own personal story. In terms of what emergency medicine looks like, I think you are going, as a brand new ER doc, you're going to have to find that one thing that fills your bucket every day at work. And that is going to be a different body of water for every one of us.
Yeah. In the last few minutes we have, typically what I've done with you, it's called 4 questions. But interestingly enough, I think the 2 of them have been covered pretty well. So I'm going to kind of the last 2. So reflecting back, what are you most proud of?
I guess I'm just I'm proud that I was involved in the project. It was, for all of us, completely unexpected, caught us completely by surprise. We felt relatively powerless to deal with what we were faced with every day. We had so many other stresses between work, life, home, family, everything else. And I'm just proud that I was a part of the group that was part of the solution to this, and proud to work next to every single tech who came in every single day and did, drew labs and did EKGs and exposed themselves for a lot less gain than we did. And the nurses, I think about the nurses at our community site, and all of a sudden got thrown in the middle of this and still came into work every day, took care of the sickest of the sick, and obviously were affected by it, but weren't fazed by any of it. And I'm just proud to have been part of the group that did this. I think no matter what comes down the road, I think we will probably never see something exactly like this again.
Stacey?
Yeah, I agree with a lot of what Steve said. I'm proud to be part of a community of emergency physicians that was a team of first responders that ran towards the emergency and not away from it. I'm proud of the team that I worked with during the pandemic, the physicians that were in the hospital, the residents, the techs, the clerk, everybody that stood tall and stood strong during this difficult time to take the best care of the patients that you could while you were dealing with personal ramifications of isolation, fear of giving it to your family, and your own personal health. And just that I work with a community of people that put the community above themselves for the greater good of humanity.
Andy?
So I guess in my early days, before going to medical school, I was involved with EMS, and the people that you work with are quite amazing. The camaraderie, it literally is. In my other aspects of life, I cannot compare the camaraderie that I have with EMS. And then moving on to ER, it is pretty similar. The camaraderie that I've had in medical school, through residency, working as an attending, it's something that you feel, and you always feel like you're not alone. And it, in a way, I thought back, but sometimes when people work together and big stresses come, they end up fighting. And when it comes to the ER world, I honestly felt it brought us even closer. When you thought that camaraderie just wouldn't get any better, it magnified. I mean, with me personally, what I went through, the amount of people that reached out and was just there for me. Not that I didn't expect they wouldn't do it, but it just feels as a whole, we're in this together. We're a special group of people. No one can really understand what we went through. And it just feels, to me, it magnifies. I guess is part of the reason why I didn't want to leave this environment.
Yeah.
I'm just proud that we showed up. I'm proud that we showed up when the first wave hit. I'm proud that we still kept on showing up for work after the clapping stopped at 7 p.m. I'm proud that we showed up for the vaccine and got vaccinated. I am proud that we showed up and stayed in the field despite the toll it took on our personal lives. And I'm proud to still keep on showing up at a job that I still love. Some days more than others.
Thank you for joining us for the Pandemic Files, produced and copyrighted by Griffin Medical LLC. For more information, please visit our website at thepandemicfiles.com.